Welcome again to another UPHS workshop. We are privileged to have 211 Big Ben here with us today to actually present on 211 Help Start Here. And what they are presenting on today is being able to access available resources, mental health and support services through your local 211. And we are honored and privileged to have Tori Greer, the president and CEO of 211 Big Ben, and her team here to present on 211 Big Ben, what they offer, how you may access it, and everything within that umbrella. So without further ado, Tori, please lead us on in this amazing presentation that you have queued up for us.
Thank you, Justin, and thank you to United Partners for Human Services for hosting this webinar, along with all the other amazing things they do. I know they host webinars each month, and we are just proud to be a member of UPHS. They provide such tremendous resources to the human services sector. So thank you, Justin, and thank you, LaShawn, for the introduction. So I'm Tori Greer. I am the president and CEO of 211 Big Bend, and I'm going to go ahead and go to the next slide here. I have some team members here today, and I'm going to introduce them shortly. But I wanted to just kind of give you an overview of what I'm hoping you will take away today from this time together. I would like for you, if you're not already familiar with 211, to learn about 211 and a little bit about its history, and discover how to access available resources in your community, crisis intervention, suicide prevention, and mental health support services available through 211. Learn how to refer someone to 211. And then also, I'm very pleased to say you'll have the opportunity to listen to a mock 211 call to understand different types of crisis and how our counselors are able to help callers and actually identify unexpressed needs that a caller may present. And lastly, I hope you'll learn how 211 data can help inform and educate the community. So those are just a few of the goals and key takeaways for today. So let's get started. So like I said, I'm Tori Greer. I've been with 211 Big Bend for just over 4 years. And at the end of December, our president of 36 years retired. And so we had a nice lengthy transition and succession plan, which was a really great scenario for an agency like ours to have that transition. I started as CEO January 1st of this year. And with us today, I have Carrie Tyree, who is our Director of Hotline Programs, Kay Meyer, who is our Director of Development and Communications, Jim Christie, who is our Director of Information Programs, and Summer Boggs, who is our Director of Administration and Special Programs. Stephen is not here today, but he is also part of the Hotline programs area of our agency. We have 35 employees, 26 of them are full-time. At any given time, we have between 50 and 60 volunteers who serve as hotline counselors. And we have 13 members on our board of directors currently. So we have a fantastic team and decades of experience working in this field of information referral and crisis intervention. So I'm actually going to skip this slide for now. Before we get into 211, your local 211 and services, I wanted to give you kind of a big kind of picture history of what 211 is. How did it start? And so going back a few decades, early on, starting in the 1960s, there were a lot of independent crisis hotlines, different independent information hotlines, and an easy to remember number was needed. And that's really how 211 came to be. 211 was first used in Atlanta in 1998, and then the FCC approved the 3-digit 211 number for community information and referral services in 2000. Our agency, 211 Big Bend, used to be called the Telephone Information and Referral Services Center, and in 2003, we implemented 211 as the direct number. And the last thing I'll mention is there's also a new 988 3-digit number for National Suicide Prevention Lifeline. And we'll talk a little bit more about that later on in the presentation. So one thing I did want to mention, and looking at the need for 211 and why this number was created, it had a lot to do with some anticipated cost savings for people, time saved in locating available resources, a decreased need for public assistance because of timely connection to available resources, reducing the number of non-emergency calls to 911 and other local government and state government entities, and also having a broad network for dissemination of public health and crisis preparedness information. So that was part of the basis for implementing 211. 200 plus independent centers across the US. 96% of the US population is covered by a 211, which is pretty incredible. 100% of the state of Florida is covered by 211. Many are blended crisis intervention and suicide prevention. So not just information referral, but a whole array of other services are provided. In Florida, we have 12 centers serving all 67 counties. And I'm really grateful to say that even though we're all separate 211 centers serving different parts of Florida, we are a very collaborative network. We often collaborate on statewide initiatives as well. And so I think, and looking at how diverse Florida is geographically and how needs vary across populations in Florida, even though we're all under the 211 umbrella, we are decentralized, and that allows us to be more responsive to local needs. And I think that's a really great thing about 211, especially in the state of Florida. Something that's kind of cool, it's in Canada too. I didn't know that until I went to an AIRS conference a couple years ago that 211 is actually in Canada. So that's I think a pretty neat thing about the 3-digit number. We are also in Florida statute. I think that's important to remember that we are actually, tasked with being that central access point for Floridians and providing comprehensive information and access to health and human service information. So another piece of the 211 infrastructure, again, looking kind of statewide, nationwide, is that we are part of disaster response and preparedness. We are a critical partner whenever there is a disaster, whether that's a pandemic or a natural disaster like a hurricane. We are heavily promoted by government and emergency management and FEMA. Locally, we're a member of COAD, which is the Community Organizations Active in Disasters. And we never shut down unless there, of course, is a direct concern for the safety of our own staff. But Carrie was around for this, but in 2016, during Hurricane Hermine, at the time we didn't have a facility generator, and we had a premise-based phone system. And phone system still worked, but we didn't have power for a few days. And we still answered calls. And this is just a quick video. Just
also
listen.
Be able to help you. Did you already have their number? Okay, I can also see if I can pull that one up for you. Okay, let me see here.
So I share that because it just, to me, demonstrates the dedication of 211 counselors, and that we step up during times of disaster. We don't shut down, and I think that's pretty incredible. So fortunately, we do have more resilient infrastructure, facility generator, and a cloud-based phone system that will allow us to respond without having to sit in the dark and answer calls, though we would still do that in the event of a disaster. And one example of how we step up during COVID-19, we saw the volume of calls statewide, not just locally, triple due to a lot of needs that arose during the pandemic. And so the statewide 211 network was part of FEMA's crisis counseling program. And what we did was helped people through emotional challenges, stress, anxiety, fear that was associated with the pandemic, as well as helping to connect people to available resources. So that is just a few of the ways that we are part of the critical kind of disaster response infrastructure in the state of Florida. So I'm going to pause and I'm going to ask you as participants, if in the chat you could list 2 to 3 words that come to mind when you think of 211. Now, if you're here because you've never heard of 211, that's fine. You know, there's no pressure there, but I think it's interesting to hear what people think of when they think of 211. So if you can take maybe a couple minutes and go into the chat, they could be, let me see if I can see the chat here. Let's see. Resource support, navigation, crisis intervention, guidance, information center, utility housing, food, help, supportive, encompassing, guidance, a person to listen, resources, crisis, information. See if I missed anything. All encompassing resource. The helpers. Thank you everyone for sharing. I think that's a good segue into learning a little bit more about your local 211. As I mentioned, even though we're under this 211 umbrella, 211 has a unique footprint in each local community. Here in the Big Bend, 211 has a 52-year history of serving this community. We are the key 24/7 suicide prevention, crisis intervention, and emotional support hotline. We have the most comprehensive human service database of information in the community, and we have staff, resource specialists who are certified in updating resources and making sure that we abide by certain national quality standards for how resources are updated. Like I mentioned, we provide 211 coverage for the 8-county Big Bend, and we also answer the National Suicide Prevention Lifeline, not only for the Big Bend, but an additional 6 counties in Northwest Florida. So that's something that I think people don't always realize, because we see that number promoted a lot. It's a 10-digit National Suicide Prevention Lifeline, but when you call that number here locally, often you are getting routed to 211 Big Bend. And so in a way, our counselors are trained, cross-trained to answer 211 and Lifeline calls that may come in involving suicide and high-risk suicide. And so that's something important to remember about the services that we provide. And we'll talk a little more about that too. Our local 211 provides some specialized care coordination programs. So not just answering calls, giving referrals, but actually helping people get connected. And so some of those specialized programs target certain populations. Help Me Grow, Florida Veterans Support Line, mental health navigation, and transportation support through Lyft Ride United. And then general community navigation support to help people find what they need and get connected to those services. And we also have 2 specialized statewide hotlines, which I'm not really going to go into too much detail there, but those are funded through the Department of Health. We answer the HIV/AIDS hotline and the Family Health line for the state of Florida. So each month, we answer 1,600 to 1,700 211 and Lifeline calls. And we're still seeing an increase in calls compared to pre-pandemic. So we did see a significant increase during the pandemic. It's steadily decreased, but still has remained higher than pre-pandemic. We provide over 300 follow-up calls each month to assess connection to services. We document all different types of needs. Many of them relate to housing, healthcare, food assistance, mental health, and other related basic needs. Some key things to remember about 211 and what we do is that all of the calls, chats, and texts are confidential. Callers can remain anonymous, so they feel safe to discuss sensitive topics. All counselors are trained in active listening techniques. We have a very thorough 75-hour training that all counselors must go through, including supervised shifts and ongoing continuing education. We have crisis intervention services that provide risk assessment for suicide, de-escalation of crisis and medical interventions if needed. We provide help, but don't make recommendations. We encourage callers to make their own choices and to be responsible for seeking help. But we offer follow-up calls and provide advocacy when needed to make sure that people are connected to what they need. When there are no services available in our community, which does often happen, and that is probably I would say the most discouraging part of probably being a hotline counselor is having to help someone when you know there's not a resource out there for them. But that's why I think it's important to reach out to 211. We can help discuss options for how someone might make changes in their resources or get help from family, friends, their church, or others in their network. And again, we conduct additional follow-up with callers to make sure they're doing okay. Did the referrals work out for them? Do we need to provide additional support to make sure they get connected to what they need? And I think you're going to hear that in the call that we're going to share with you, and Carrie's going to kind of help us debrief from that. That's going to give you a better, I think, understanding of what it's like to call 211 and what our counselors do when you do contact us. So I've got one more slide and then we're going to listen to this call. So to summarize, just what needs we address as a hotline. Of course, basic needs of the general population. A majority of callers present more than one need, and often it is for something related to food assistance. Transportation is a big one. It's a growing need as well. Healthcare, mental health, disaster assistance. But we're also answering calls from people who are dealing with social isolation, loneliness, and mental health issues, especially as we've gone through this pandemic. We've seen more and more of those types of calls, longer calls where people need more support. I mentioned suicide prevention and intervention, and then some of our specialized programs to help children that are at risk for developmental or behavioral concerns. We provide support and linkages to other services that can help families with children who have those types of concerns. And then of course we have veterans on staff that provide peer support to veterans who call our hotline. Lastly, we serve as a 24/7 access point to services and other community resources. And based on data that we've seen through call records, as well as local needs assessments that you've probably read yourself, many Leon County children and adults lack sufficient access to mental and behavioral health services and information. Oftentimes, residents and visitors struggle to navigate the system. Sometimes they don't know where to start. And 211 is just the best starting point. And I can't really, if there's one thing you take away from that, it's that 211 strives to be that access point. When someone doesn't know where to turn to 211. So the next part, we're going to pause. We're going to listen to a 211 call, and actually it's not a real 211 call. Two of our hotline counselors basically put together kind of a very similar call that we might receive. So I'm going to ask you to listen to it, and then Carrie Tyree, our director of hotline programs, is going to discuss the call and maybe ask for some engagement from you on your thoughts on this call. So here we go.
Thank you for calling Helpline 211. If this is a life-threatening emergency, please hang up and dial 911. All incoming and outgoing calls are recorded for quality assurance. To speak to a hotline counselor, please press 0. If you are in need of mental health counseling referrals, please press 9 to speak to a mental health navigator. If
Helpline 211, this is Kathy.
Hey, Kathy. I was giving y'all a call. I heard from a friend that y'all might be able to help.
Yeah, so as I mentioned, my name is Kathy. Can I have a name to refer to you by while we're talking?
Sure. My name is Mac.
Mac? Okay, Mac, yeah, you mentioned that you heard about our number from a friend and you were looking for some resources to help. Do you mind telling me what's been going on?
Yeah. I've just been going through a tougher time lately, kind of down on my luck, and I'm in a tight spot right now. I guess part of what's going on is I just don't have enough food in the house. I'm just really out of things to eat for me and the kids.
Yeah, you can hear how difficult it's been. You mentioned you are in a tight spot at the moment, and it's been difficult to keep food on the table for you and your kids. What happened recently that has you in a tight spot?
It's a whole bunch of things. I think it's been a bad couple of years for everybody. Yeah, I just haven't had as much money coming in lately. You know how it is. I think a lot of people have been going through that, and things just keep getting more expensive.
Yeah, things have been changing rapidly, and it sounds like it's been overwhelming to try and maintain bearings within that and continue to provide for you and your family, and it's devastating. You mentioned that you were looking for food resources. Are there other things that you're interested in? I didn't explain before, but here at Helpline 211, we're a short-term crisis counseling, information, and social service referral agency. So we provide a variety of different things, Mac, and I'm really glad that you reached out to us today because I can hear that you've been struggling. Are you the only person that makes money for the family?
Yeah, well, no, I guess at this point, no. I lost my job about a month ago. And since then it's been just my wife, which, I mean, she works, but it's just not enough to kind of we were already kind of just trying to keep our heads above water. I was making pretty good money, and fortunately though, we just have debt. So although I was doing okay money-wise, we hadn't really gotten in the green yet.
Yeah, and it can be stressful to have two incomes and then go down to one. And you mentioned that you had children as well. So managing all of that with less money is a lot to deal with and a lot to handle. I just wanted to check in, Mac. How have you been dealing emotionally with everything? I know you mentioned you called for resources, but we also provide emotional and supportive counseling. And I just wanted to check in with how you were doing and how you were feeling emotionally.
It's not been good. Things have just things have been rough, and it's just, it's kind of that like looming darkness, and I don't know. I'm just under a lot of pressure.
Yeah, you describe this looming darkness and the significant amount of pressure that you're under. Oftentimes people who have experienced devastation and are going through difficult times can consider suicide. Is that something that you're going through, Mac?
No, no, I'm not having thoughts of suicide. I've just really been constantly overwhelmed, and it's like every day it's just a little more. And I guess like part of my situation is I feel a lot of responsibility for it. Losing my job was my fault. I was drinking and coming into work drunk, and that's by and large how I get by. And I was actually working in a vet office, and just when you go to school to become a vet technician, people don't know, I guess, but no one's really able to prepare you for how many animals you're gonna wind up watching die.
Yeah, I can hear how awful that experience has been for you, and it sounds like you've been a vet tech for a number of different years, and the toll that's taken on you over the years as you've witnessed animals in all states of health and having to work with them, and some of them, as you mentioned, do pass away and die. And so the toll that's taken on you, and you mentioned that it's led you to drink most days, you said?
Yeah. I mean, I guess I've kind of always been a bit of a drinker, but just the harder work got, the more I would. And I was able to get away with it up until I wasn't, I guess.
I'm going to pause it there. Carrie, would you like to talk a little bit about this call?
Sure. So first I want to check in with the audience. How did that call make you feel? What kind of feelings? You can say it or put it in the chat. What was your thoughts about the process, or how the gentleman Mac was unfolding or letting go of some of that stress he's been going through? Any thoughts?
Looks like there's a chat.
He was relatable.
Yeah, relatable.
Yeah. A lot of weight, sadness. The active listening was awesome, right? Paraphrasing. That's one of the techniques that we use in order for a caller to know that we're listening, right? A lot of times in communication nowadays, people just want to get their point across. I'm guilty of it. I'm excited to talk about something, so I'll sometimes talk over, not really listen to the other person because I'm really interested in getting my point of view across. I think the fact that this agent was actively listening, paraphrasing those things back, is important, because it also lets the caller Mac in this situation listen to his words back, helps him think for a minute before he makes his next statement. First thing I wanted to talk about was that there's no typical call. I've been here a long time. I've had everything from someone calling to tell us they've got a snake in their pool to, I'm fighting with my husband. He hates my food. What can I do about that? to suicide, domestic violence. So every time the phone rings, the counselor has to really stop and listen, because that call could be anything. One thing that stuck out for me is that we try to normalize suicide, right? By saying, a lot of times when someone is going through a situation like this, they could be thinking about killing themselves. Are you having those thoughts? Just giving Mac permission to say yes or no. That's a question people don't like to ask. They're afraid that we're going to put ideas in someone's head. You can't put suicide in someone's head. What you can do is allow them to talk about it. So Max said no for suicide, but he's going through a lot. At the very beginning of the call, he kept saying, everyone's going through this. Everyone's having a hard time, right? That's I think, not to stereotype gender, but I think it's hard for a man to say that just because everyone's going through it. We're talking about you, Mac. Yeah, what you're going through. It could be common that people are going through this, but the focus is on you today. He's a veterinarian or a vet tech, highest rate of suicide, right along with police officers, EMS, very high rates of suicide. You go into the field wanting to help animals, and you do have to put a lot of animals down, either by choice of the owner of the animal or by sickness and death, and that takes a big toll. And he was using drinking as a coping mechanism until the drinking didn't work anymore, obviously. At this call, at the end of the call, this very skilled, awesome counselor, Jade, would have offered a follow-up, and we would have gave him referrals. Not always, because not every call ends with referrals. Some calls are just about letting someone talk about what they're going through and kind of purging those emotions. I think there was a lot that was said under the surface that she picked up on, but it was a really therapeutic call. And just the fact she said, how are you dealing emotionally? People don't expect that when they call anyone, right? They're going to get referrals, they're going to get help, but they don't expect someone to just check in on their emotional health. And so that is a good way to get that conversation going, to see what kind of services he may need, if any. So one of the things that I wanted to talk about is that there's not if you want to say what's the face of someone that calls 211, I've been at the agency for 22 years. When I first started, it was because I actually called the hotline. The Capital Regional Rehab, I think they've changed their name, shared at discharge numbers to get help. And one of them was telephone counseling and referral service. 224 NEED was the number. I remember it. I called because I needed transportation living in Wakulla to get to doctor's visits. I had broke my neck in a diving accident in a sinkhole in Crawfordville. My husband was about to go broke trying to get me to all these doctor's appointments and still work. He had his own construction company. So when I called, I was calling to try to find free or low-cost transportation. What I didn't expect is the counselor didn't just wait and offer what I was asking for. She started reading between the lines of what was not said. So what happened was she asked me, how did I feel now that I'm a person with a disability? Has that changed my life, my perception, how I looked at the world, how I looked at my family? And that question need it to happen. I had went through all types of occupational therapy, physical therapy, doctor's appointments, but nobody really asked me that question. And a call that should have been 10 minutes turned into an hour conversation about being a mom with a disability, being a wife with a disability, how that looked as far as, you know, things like sexuality. Sometimes people look at people with disabilities and think that they're non-sexual. That was a conversation that happened that was super therapeutic. And I told myself, if I get on my feet, literally and figuratively, I'm going to volunteer there. Push back to 2000, I saw a billboard, and then I applied for a position or as a volunteer. You have to apply, not everyone's accepted. And so that's the face of 211, going the extra mile on a hotline call. And the thing that I think about now is when I think about the fact that 211 being obsolete, I started to worry everyone can get what they need online for referrals, right? Obviously, they're going to get information that's not updated all the time, like our information. Maybe they don't have options online, but I started to worry about that. And then I think, you know, an AI or the internet is not going to pick up on what's going on behind the scenes. They're not going to bring up what's not said on a hotline call. So there's no way that we're ever going to be replaced, because it takes a human on the other end of a chat, text, or call to have a human connection.
Thank you, Carrie. So since in this call, like Carrie mentioned, the counselor did ask Mac if he had thought about suicide. I wanted to mention the resources that are available to you locally. So as I mentioned, we answer the National Suicide Prevention Lifeline for the Big Bend, and it's going to be replaced by another 3-digit number, 988, and it will be live in July, and we'll see additional promotions around that 3-digit number that will be very easy to remember. And we're projecting a quite significant increase in call volume, and so we're in the planning phase along with many other 211s and crisis centers in Florida for that implementation. So suicide was responsible for more than 47,000 deaths in 2019, which is about 1 in every 11 minutes. And oftentimes it's believed that most individuals that have thoughts of suicide do want to live. They just feel trapped in their current situation and they want to end the pain. Crisis tends to be brief, and when that is identified early, lives can be saved. And we all have a role in that. It doesn't require any specialized professional background. There's a lot of things we can do together to prevent suicide. One of those is to be aware of local resources like 211 and this new, the new 3-digit number that will replace the National Suicide Prevention Lifeline. And then also to be aware of available training as well. And one thing that we offer here at 211 Big Bend is something called ASSIST, which is Applied Suicide Intervention Skills. And that's a 2-day training offered that teaches you how to assist someone who may be thinking about suicide. Anyone can learn, regardless of professional background, as I mentioned. For me, I took it a couple years ago without any experience in that area, and it was life-changing for me, and it empowered me to actually talk about this, because I feel like like Carrie mentioned, this is something that I think we don't talk about enough. So that's a resource that I'd like for everybody to be available, be aware of. And if you are interested in that training, there is a form that we can send out, and you can express your interest, whether you want your agency to take it or your business or your employees to take it. We would be happy to work with you on that. So I wanted to mention those available resources. This is the link to the JOT form, but if maybe Carrie, if you could put that in the chat, that would be helpful. There's also a lot of good information. The National Suicide Prevention Lifeline website has some great resources. Be the One Too has some very helpful resources for basically how to steps you can take immediately to help keep people safe. We'll keep going. Another resource here locally is the Mental Health Council of the Big Bend. 211 is a member, along with there's many other agencies that are part of this council. And I wanted to mention that coming up is Be Kind to Your Mind.
In the chat.
Pardon? Coming up is Be Kind to Your Mind. And that's on May 17th. So that's something to be aware of as well, that can be another way to get involved. So right now I'm going to transition to and introduce Summer Boggs. Summer joined our team in October. She manages some of our kind of specialized care coordination and peer support programs, and she's going to go into those and so that you're aware of those resources as well. Summer came to us from Big Brothers Big Sisters. She has wonderful experience and has just, I think, brought a great kind of perspective to these programs. So I'm grateful to have her on the team as well. And so Summer, we're at 10:45, so the time is flying, and I want to leave some room for questions. So we may want to just kind of be concise with going over some of these resources.
Good thing. Good morning, everyone. So I'll just talk briefly about a couple of our kind of specialized programs that we have. So we offer care coordination and peer support in a couple of different ways. One of the programs is called Help Me Grow. So that is a program where if there's a child in the home ages 0 to 8, they can get connected with Help Me Grow, and they can provide free developmental screenings such as the Ages and Stages questionnaire, otherwise known as the ASQ. They also help provide personalized care coordination. So if during the stages of any of the screenings, any concerns were raised, they're able to help direct people to an exact organization that can help them with whatever specific issue that might be. They help provide family and community outreach as well. So they're participating in regular community screenings put on by some of our partners, and as well as tabling at many of our great community-wide events such as Kids Fest that just happened recently. You might see them out from time to time at the booths. Please stop by and say hello. They also offer child care provider outreach. They're reaching out to those providers who have the one-to-one access with the families to try to inform them about our program so they can be more informed when speaking to members of the community. I'd also like to talk briefly about the Florida Veterans Support Line. So that's a toll-free number that veterans and their loved ones can call, both for emotional support and information pertaining to community resources. So we can help them get connected to the local VA, as well as connect them to any of the resources that you've heard us talk about here today. Another program that we have is two other separate programs that we have are the Lyft Ride United and DoorDash delivery programs. So we have a program with a partnership through Lyft and United Way Worldwide, where we're able to provide about 2,000 rides per year to members of the community through Lyft rides. We can provide rides to food pantries, clothing pantries, healthcare appointments, those VA appointments that I mentioned a moment ago, and also for anyone needing employment as well as pre-employment needs such as replacing an ID. And then our partnership with Second Harvest of the Big Bend allows us to provide supplemental food deliveries to seniors and other vulnerable individuals, some people maybe with disabilities, some other veterans, that are there. So we have a question about some more info on the Lyft rides. I will put my email in the chat, and or we're going to open up for questions, and we'll be happy to take some questions here at the end here in just a few moments.
Thanks, Summer. Yeah, we'll talk at the very end about how to get connected to Lyft. If it is, we do find that transportation is just, there's such a significant need for transportation in this community, and so we are working to try to grow that Lyft program as much as we can, so we can help in other ways. I also want to mention the mental health navigation. That's another kind of a care coordination and follow-up program we have. We have a mental health directory that is actually covers 18 counties, but we work to update all of the mental health providers in this area. And if you actually dial 211 and press 9, you can actually get connected to a mental health navigator if one is available, and they'll help you get connected to a mental health resource, and will also help with scheduling if they can, and help you get connected. So that's another resource that I want everybody to be aware of, and that's a partnership with the city and the county. So we are grateful for their support of that initiative. So I'm going to try to be brief here, but I want everybody to know about our resource directory. Jim Christie he is our Director of Information Programs, and he and his team manage our resources and all of the quality standards that we adhere to as an accredited AIRS agency. So it's not just a list, it's actually, our staff are very careful to follow standards and how we categorize needs and referrals. So if you go to 211bigbend.org, you can get access to our searchable database. If you have any questions or you're not able to find something, please call 211. If you have questions about how to update a resource, so if you're a provider and you see that some eligibility criteria has changed or your hours of operation has changed, there is a form on our website, and you can also call us as well. And we'll help you with updating that information. We don't expect that providers go in and update their own information. We know everybody is busy, and we have staff here that can help you with making those changes. And we do collect a lot of data. Now, this is anonymous, aggregated data, but these are just some examples of the type of data that we do collect. And I mention this because I talked in the beginning about how 211 data can inform community decisions. And I think it's important that everyone understands that 211 data really can be used as a barometer for what where the gaps are and where the service gaps are, where resources are needed. We also have actually a dashboard. It's called 211counts.org, which can give you kind of a quick snapshot of requests by zip code. So this is food specific to 32304, shows the poverty rate, the unemployment rate in this particular zip code. And I think that that can be used as a resource as well for you if you're interested to see what that data looks like and drill down to zip code. It's called 211counts.org, and you can look statewide, you can look anywhere in the state of Florida, and then you can also drill down to the Big Bend area, Leon County, and then specific zip codes. So that's another resource for you. And I'll end on this. During COVID-19, I think there was just so much awareness around 211, because we were one of the only, we never closed. A lot of people started calling us because they needed help. And This was in an article in Health Affairs. Understanding which needs are rising and falling in which neighborhoods should inform community priorities and resource allocation to better and more efficiently meet demand. Should be a major part of efforts to modernize the social service sector. So I wanted to mention that because that's just that inspires me, and I think of all the ways that 2-in-1 can be used to help improve services, and I would like to see that that grow in years to come. So lastly, how to refer to 2-in-1. We have obviously we have a website, 211bigbend.org. You can call 2-in-1 or our 10-digit local number. You can text your zip code to 898-211. I want to note that we are working to expand our texting capabilities a little more, so that number may evolve. We'd like to do more follow-ups via text as well. We know a lot of people use text, and so we are working on that, but we do have an option, a text option, 898-211. You can do a web chat with a 2-in-1 counselor. And again, that's going to our website, and you can open up the chat. And then, of course, our online resource directory is available for you to use as well. This is my contact information. And I noted my full name is Victoria, so it's V Greer, not T Greer at 211bigbend.org. I realize that's confusing, but this is my email and my phone number. Please don't hesitate to reach out to me. If it's something I can't answer, I will work to direct you to the right staff person on staff. And then, of course, our website has a contact page where you can direct a question to certain staff. So I'll stop there because I really want to open it up to questions you have, and we've got a few minutes left. So if you want to put something in the chat, I think it looks like there are some chat. And okay, Big Bend AHAC, okay. Lyft, so you want to talk a little more about Lyft. It said there was a question about maybe how to access the Lyft ride program. Summer, maybe that's something you could speak to.
Sure. So you can call just 211 and ask to be connected to the Lyft program. From there, they can help schedule a ride to and from wherever you're trying to go. Again, that can be for a healthcare appointment. We can do rides to and from the VA, rides to and from job interviews and things for pre-employment job needs, as well as rides to food and clothing banks. If you have another more direct question, please feel free to elaborate as well.
Does 211 offer any temporary housing resources or partners with any agencies that offer this service? We know that we see a lot of calls about housing. I know Carrie or Jem, if either one of you want to speak to that. We don't directly offer housing, but we do refer to agencies that provide housing. I'd have to kind of do a little research to be able to specifically answer your question about those resources.
I can give it a shot, and
okay,
Carrie,
thanks, Jem.
feel free to correct me, Carrie. So we do keep in contact with many of the local housing resources. The Big Bend Continuum of Care, the Big Bend Homeless Coalition. I think what Tori mentioned was 2-in-1 is a great place to start. So if you have no idea what housing options are available, and let's be honest, they are limited, 2-in-1 is a great place to start. The basic needs in our database, the programs that provide basic needs, food, housing, shelter, so forth, clothing, we keep those updated as frequently as we can, sometimes multiple times a day. Definitely at least once a year, multiple times a year. As funding ebbs and flows, those services change. They might have, for example, a low-cost housing apartment building might have some limited funds available. So we would, make sure that we have that information, or at least provide the appropriate provider to send the caller to. What we hope is that the call to 211 is hopefully one of the last calls they'll need to make. Their next call hopefully will get them the service that they actually can use. So having said all that, Margot is our primary resource specialist who handles those basic needs. She's been at the agency for more than 30 years. She started out as a counselor. She works with Leon County, their housing program, all the outlying counties, to make sure any grants or programs are available, for example, the CARES Act and so forth. So that's a broad picture, but yeah, we do have a number of resources in our database. It kind of depends on availability, but I'll leave it at that. And Carrie, feel free to add anything.
I just wanted to add, that goes back to Tori's point about 211 offering the data to show where the gaps are. We do have multiple referrals in our database for housing, but it's just not enough and it's getting worse. And so the data, when we take if we can't give a referral because the caller's already tried everything or they're not eligible, that would be an unmet need that we record. And that data is used hopefully to inform.
Thank you, Carrie and Jem.
So I wanted to just hop in because I'm looking at the time and we're real committed to making sure we finish on time. So just a couple of things. So Justin and I are taking notes of the questions in the chat. UPHS is going to be working very closely with 211 in the next couple of months. So for those of you all that have very specific Boys Town, for example, I see your question. We'll make sure we loop you with Tori in the team because I think this is a great opportunity to have a meeting, talk about ways to get resources out to your parents. So this was one of the reasons why we were very excited about this workshop, because we wanted to make sure that everyone was connected to the team and that we all are working together collectively. So the 211 team is open, available, and is a major resource to the community. So if we didn't get a chance to get your question answered, we made note of it. This presentation is going to be available. Justin's going to post it on our YouTube channel, and you'll also see it on our social media page. And then if you're interested in the PowerPoint, again, you could just shoot Justin an email and he'll make sure that he sends it to you. And so we want to thank our friends over at 211 for presenting great presentation. I think we all learned a lot today. And thank you all for joining us. Everyone on the call provides a service to people, service to the community. So it's always great to know what support is out there for those clients, those members, those entities that we're working with. And so be well. As I said, we're right at 11 o'clock and we will see you soon.
Thank you, everyone.
Bye.
This was a great discussion. Okay, bye.